Okay, so welcome everybody to this webinar about the Global Mentoring Program from the WFSA. My name is Luiz Fernando Falcão. I'm the Director of Memberships of the WFSA, and I will be one of the chair of this session. And the co-chair of this session with me will be Dr. Juliet Hood. Dr. Juliet, she's an anesthesiologist in the UK, and she was of our mentor in the Global Anesthesia Mentoring Program. Actually, she's much more than that. She's one of the coordinator of the program, so she's behind with a lot of hard work for this mentoring program works inside the WFSA. And before I start, I would like to invite all of you here to attend our World Congress of Anesthesiologists, which will be in next year in Marrakesh, in Morocco. Would be a great opportunity of a networking, would be a great opportunity to meet all the mentors and mentees that we have inside the WFSA. And this will be our agenda for this next 1 hour of webinar. So we have here with us 4 very important speakers, 2 mentors and 2 mentees. But I will let Juliet introduce our speakers later for all of you. We'll have one first talk about how to be a mentor and another talk about how to be a mentee. This is a very important webinar for us because we are running the Global Mentoring Program for a half a year, and we are having an amazing feedbacks from the mentors and the mentees. This is a very, very important program for the WFSA in order to empower the anesthesiologists around the globe. This is a unique opportunity for us to improve our knowledge, our skills, as a mentee to learn with a more experienced professional around the globe. So we'll have an opportunity at the end to have a Q&A session and to do many questions as we want and to clarify any doubts that we have. Here are some housekeeping notes that first about the Q&A. Please feel free to put your questions in the Q&A feature that we have in the Zoom. All questions will be answered at the end, and you can use your mic as well. So if you want to talk, please just raise your hand here on the Zoom and open your microphone to do your question. We will be very happy to answer all questions that raised here during the webinar. But we do all the questions only at the end. The Zoom has a translation features based on AI, so you can turn on your translation and we can choose in a more than 30 different languages. To all the attendants of this webinar, we'll have a certificate, and this certificate will be issued within 10 business days. We'll receive by email. But to receive the certificate, you need to attend at least 60 minutes of this webinar. And all these webinars are being recorded and will be published on YouTube in 48 hours. You can find this webinar on the WFSA website as well. As I mentioned before, this is a very important webinar because they will give us information and we can set our expectation how to be a mentor, how to be a mentee, how to engage this couple of a mentor and mentee to have the best way to enjoy the program. Before I do my handover to Juliet to present our speaker, I would like to ask Rosa, Rosa is from the WFSA, and she's helping us in this webinar. She just put two questions in a very quick poll that we can answer. The first one, we can answer, what is your role? What is my role in the WFSA mentorship program today? I'm a mentor, I'm a mentee. Please take a vote, and we'd stay a few minutes for the vote, a few seconds for the votes. So the people are still joining the session, but it looks like that was half and half, but we have more mentors than mentees. We have 40% of mentors and 30% as a mentee. Okay, thank you very much for the question, for your answer. And the second question that Rosa is putting in our screen now, it's about how we feel confident in our role as a mentor or as a mentee. Please, you can score from 1 to 10, where 1, you are not confident at all in your position as a mentor and a mentee, and 10, you are extremely confident in your role as a mentor or as a mentee. Please take the vote. Okay, perfect. Thank you very much. It's good to know that we have 40% and a score 9, very confident. But we have some score here of 3 and 4. So thank you very much for your vote. This will be very important for us. Let me share. I have it out. Juliet, can you see the answer of the poll, or only I was seeing?
I can see the answers.
You can see the answer. Perfect. Okay. I thought it was only me. Perfect. So we have here 40% of mentors, 30% of mentee, and about the level of confidence, we have the majority, 40%, 9, extremely confident, but we have some answers in 3 and 4. Perfect. This will be very important for us because who is not that confident can make questions and clarify any kind of questions, but who is a lot of confidence can share for us with our experience. But so now I would like to hand over to my co-chair, Dr. Juliet Prue, that she can introduce our speakers. And once again, thank you very much for all of you here. Thank you very much for our speakers. It will be very, very important to share your knowledge with us. Thank you.
Hello, everybody. Good evening or good morning, or I think for some of you it's the middle of the night, and some of you will be catching up the next day to watch this. We're very excited this evening to have some very experienced mentors to talk to us about how to be a mentor. So I'd like to introduce you to our two speakers on as mentors. That's Dr. Redfern. She is a consultant in anesthetic consultant in Newcastle upon Tyne with an interest in obstetrics and neuroanesthesia. She has introduced mentoring to the UK Association of Anesthesiologists, and that course has now been running for a number of years and has fantastic feedback. She's also established and co-leads the mentor development programme for the physicians and surgeons of Glasgow. She has an interest in staff wellbeing, mentorship, education and workforce, and she co-chairs the Workforce Working Conditions and Welfare Committee of the European Board of Anaesthesia. She supports a wide range of colleagues from medical students to chairs of national committees, and I know she works very closely with Dr. Sheraton, who is our other speaker on how to be a mentor. She's a consultant anaesthetist in Newport, South Wales. She has a long-standing interest in global health, and she is currently mentoring a number of mentees in the Yemen. She's involved with the International Relationship Committee of the Association of Anaesthetists since 2010. She's first Associate Board Diversity Lead. She's the Honorary Membership Secretary, Vice President, and she's actively involved in a Safe Anaesthesia from Education program, which has been running since 2011, and again is a fantastic course. And I'm sure some of you might have already have been on a SAFE course. So I'd like to introduce the two of them to talk to us about actually how to be a mentor. I know it's very hard to cover this in a short talk because this is a lifetime of committing to being a mentor and learning all the skills. But if they could nicely summarize it for us, that would be brilliant. Thank you, Dr. Sheridan. Redfern.
Thank you. So thank you very much for inviting me, and I'm delighted to be speaking about two of my favourite topics, which is global anaesthesia and mentoring. Now, how do I do that from the start? So can you see my screen, and does that look all right?
Yes.
Okay. That's fine. So I've been asked to talk about how to be a good mentor. Nancy hasn't got such a great internet connection, so I'm going to speak, but Nancy has kindly agreed to be available as well for the questions and answers at the end. So I first went on the mentoring course that Nancy runs actually in 2017, and I have to say that it's been the most impactful training of my entire career. So for those of you that are interested in doing a bit more or getting a bit more training in it, then I'd say go for it. It's something that's been really, really rewarding for me. So this is the kind of structure of what I'm going to talk about, what mentoring is, what mentoring isn't, from our particular perspective. And it may be that the WFSA has a different perspective, and it may be that you want to do something slightly different. So I'm not saying this is the only way to do it, but I'm saying this is what we have found works quite effectively. I'm going to talk a little bit about clear and ethical terms of engagement, which I think the mentees will probably have a bit more to talk about that on as well, so that they can give their experiences, and a little bit about Egan's model of the skilled helper, which is one of the models that we've chosen to use in the association training because well, for a number of reasons. And then quick summary and some questions. The questions are going to be at the end of all of the presentations. So what is mentoring? So for us, mentoring is a learning relationship. So both partners, both the mentor and the mentee, should be gaining something from the relationship. And I think in the when you've got somebody from a very different setting to somebody else, or maybe somebody's in a high income country, somebody's in a low middle income country, that the environments in which you're working are so different that you can learn huge amounts. Certainly, I've learned huge amounts from the people that I've mentored in low middle income countries as a mentor, and hopefully that they've learned something from me as well, because you're looking at things from a very different perspective, and that's very, very rewarding. So this is what Connor, well, you can read who said it, but they said it was a trusted and faithful guide for a person on a journey of personal, professional, and career development. So the idea is that you're walking alongside the person and influencing them, but you're not making decisions for them or telling them what they should do, because that person already knows what would be, or already has all the information that's necessary for them to be able to make the decisions that are right for them. This is quite an important part of the whole idea as well, is that to have a framework. So we know that mentoring schemes where a framework is used tend to be more successful than those that don't have a framework. And we'll go through an example of Egan's model a little bit later on. But the idea is that you're both responding to the change and promoting the change in the mentee. And so that they get a vision of new possibilities, and that there's some action taken at the end. That's quite important, so that you work through all of the things that are going around in somebody's head and come to some actions that they're going to take, and they say those out loud. And the idea is that then will make them more likely to go on and do those things because they've come up with the solutions themselves and the actions themselves, and they're just relaying them to you as the mentor. This is a book that we refer to quite extensively, and I'd recommend it to anyone who wants to dive a little bit more into coaching and mentoring. And this is what Mary Connor and Julia Pecora say that mentoring is. So it's a learning relationship, which we've already said, which helps people to take charge of their own development, to release their potential and to achieve results that they value. So that doesn't mean to say that you have to have a problem or that you have to be struggling. It could just be that you have a challenge or a dilemma, and the idea is to take somebody from good to great and to walk alongside them in that journey, and for them to resolve that in the way that's best for them and at the pace that's best for them. So the mentor is the expert on the process, and so they have this map, and that's at the top there is the a model of Egan's skilled helper model, which I'll talk about a bit later on. So the mentor is the expert on the process of reading the map, but the mentee is the expert on the mentee. So nobody knows Tay Sheraton like Tay Sheraton knows Tay Sheraton, because I've been here for my entire life, spent all my time with myself, understand what my strengths, my weaknesses are, and all the mentor, or what a good mentor is doing, is helping that person to understand what their strengths are, what their weaknesses are, to challenge them enough, and to help them to move forward to solve their challenge or dilemma in whatever way they think is most appropriate. So who is mentoring for? Well, I would say that mentoring is for everybody, but these are kind of indications of who might find it most useful. Somebody that would benefit from a productive conversation. So as an example, when you have a lot of different thoughts or ideas or going around in your head and you don't know really which one is the most important, what is the most important for me right now, by vocalizing what you're thinking to another person, it can suddenly help to tidy up all of that untangled mess and bring out what is it that is most important right now for me to work on, that will help me move my life in the direction I want it to move in. So somebody might have a personal dilemma, they might have a professional dilemma. It's particularly useful at times when there's a transition. So when you're changing from run one role to another role. And the GMC, the General Medical Council in the UK, recognises this and recommends that people should be using a mentor, particularly at periods of transition, and that those mentors should be trained. It's useful if you've got a new role or you're stepping down from a role and you're looking for something to fill that gap, especially new trainees, new consultants. They will often find a mentoring session or a series of mentoring sessions very useful. And as you're coming up to career change and retirement as well, those are other times when we find that people find it very useful. What mentoring is not is patronage or sponsorship. So that is where somebody who's more senior and more experienced is helping somebody follow the same path as I have followed, because I'm not the same person as the person I'm mentoring, and they have different skills, different experience, and I can be mentored by somebody who is less experienced than me, but just by asking the right questions and challenging me in the right way, I can still come to actions and plans that will help me to move forward. Mentoring is about learning. It's about the present, what's happening right now, what's realistic right now, and it recognises that the person is functional and effective in their own world. And in that relationship that we want in the ideal, the mentee is the expert. It also isn't counselling. So we don't need to understand every issue about the past to understand the present. We don't need to have a long-term, in-depth whole person insight. It's just about what's going on now and what would be most useful to deal with now. These are some of the elements when you're setting up your mentoring program or how things might work that you might want to think about. That the learning relationship's at the heart, context of the relationship is work, the mentee sets the agenda and is recognised as resourceful, and the mentor facilitates learning and development, and the outcome is change. That's very important. And the framework for the change process provides movement and direction. And the skills that you develop give insight, release potential, and deliver results. And the qualities of the coach or the mentor affirm, enable, and sustain the mentee. And you want to be doing this in an ethical way that safeguards and enhances the coaching and the mentoring. So the three main qualities of a good mentor, I would say, are to be genuine, to be empathic, and be respectful. And so if you manage those three things, then that's a really, really good start. The core skill of an excellent mentor is to be able to balance that support and challenge. So when people, different personalities or people at different stages of their life, that if you're really struggling a bit with lots and lots of things going on, that may not be the best time to offer a lot of challenge to somebody. What makes you think that? What makes you think that you can't do this or you can't do that? It may be that person needs a bit more support than somebody who's just jumping immediately to the conclusions. So you want to be able to open up opportunities and ways of thinking about things as a mentor. So when you're thinking about your terms of engagement, whatever those might be, these are some of the things you need to think about. You need to think about how much time are we going to give to this, and when is that time going to happen? How long is the session going to be? How many sessions do we think we're going to need? And then you need to think about a space where that's going to happen. It's really important that the whole process feels safe. And so that space needs to be private and not having people coming and going. You might do it online, you might do it in person. It needs to be confidential, and that needs to be laid out at the beginning, but there will be boundaries to that confidentiality. And again, that needs to be laid out at the beginning. If the person was likely to harm themselves or you thought they might harm somebody else, then you would say, at this point, I might breach your confidentiality, but I would tell you first. And that's very unusual, but I think it is important to lay that out right at the beginning. If things aren't working for either party, how you might end the relationship, and then thinking about what other support the mentor and the mentee might need. And then there's the training and competence of both of the mentors, and having some kind of reflective practice. So at the end of a session, each, maybe the mentor and the mentee, thinking about what they did well, what they didn't do so well, and what they might do differently next time. Having a network of people that you can discuss challenges with as a mentor is really, really useful and important, I think. So Egan's model, this is Egan's model, which there are many different models, but this is just one of them that you can use. And it has these 9 different boxes, and each of, sorry, I can't count it as 9. So in each of the different boxes, you're doing different things, and you can move between the different boxes as suits. So it's just a guide. And you don't, sometimes some of the boxes don't particularly work for a particular situation, and that's all okay. But the idea is that you have some kind of structure that you're fitting everything into, so that you're thinking about what you're doing at each of the stages. And there are different skills that you use in each of the different stages. And you come up with a plan at the end of it. Even if it's a very simple plan, it is quite important to go away with some action. So you're helping someone to manage their problems, develop opportunities, maximize their resources, and become better at helping themselves. And it's safe. So what you don't do as the mentor is know the answer, agree with the mentee, do all the work, give advice, or take ownership of the issue or solve the problem. So the issue or the challenge remains the mentee's challenge, and your role as the mentor is to help with that. Here's some myths that I realise I'm running out of time. So there's a range of definitions and models of mentoring, and our experience from the Association of Anaesthetists in the UK and other mentoring schemes is that mentors, when they're trained, use those skills both formally and informally. So the listening skills, the reflective skills, the challenging gently, and both the mentors and the mentees generally find it very useful. So setting up a robust scheme needs a bit of planning and resource, as you've already done at the WFSA. And yeah, it's a fantastic opportunity to take people from, like I said, good to great. Thank you.
Brilliant. Thank you, Sheraton. That was brilliant, and a really good reminder for mentors, the skills needed, the approach to take. And I think we all find ourselves sometimes as mentors just wanting to give people answers and help people. And it's so important to remember that you're there to support, but not to give the answers, but to help that person find their way themselves rather than giving them your solutions. So rather than forcing your help on them, but to help them help themselves. So a lot of mentorship is about being driven, is to be driven, has to be driven by the mentees. So the next part of this webinar is to ask two mentees currently in the program to talk about how they initiated being a mentee with their mentors, how they went from signing up to the program to having a successful mentorship relationship, which I believe both of them are having a successful mentorship relationship. So I'd like you to introduce you to Dr. Daniela. She's a physician with a specialist interest in pediatric anesthesiologist. She holds a doctorate in medicine from the Evangelina University of El Salvador. She is committed to maternal and child health, and she wants to provide high quality care in anesthesia. Her work is supported by strong academic foundation and extensive clinical experience. And she's also serving as the president of the Association of Anesthesiologists Physicians of El Salvador. So thank you so much, Daniela, for talking about how you approach being a mentee within the WFSA mentorship program. I'll hand over.
Thank you, Juliet. Good day, everyone. I'm here talking from El Salvador. I hope you hear me well. And today I want to talk about how to be a mentee. Next slide, please, Rosa. As a young doctor, being a mentee is important for your growth. A mentor can help you understand your career better, share useful advice, and help you build important skills and connections in medicine, and making you a more confident and effective healthcare professional. As we can see here, my mentor is holding my flashlight, and it's giving me a better guidance to what I'm seeking and what I'm looking at to help me develop and guide me towards my goal. Next slide, please. In my situation, when the WFSA launched in April of 2024, the Global Anesthesia Mentoring Program, that same year and that same time, I was elected as president of the Asociación de Médicos Anestesiólogos del Salvador in my country. And I had no previous experience in leadership other than teaching my students at the National Specialty Program. So why I wanted to become a mentee? Because I had no experience and I needed some help. I was very interested in advice, networking, and sharing of experience and expertise in the field of leadership. So I went online and I filled up the form in the Survey Monkey. and I waited for my application to be reviewed, and a match was made. I asked for a match, a mentor in Latin America, in Spanish or English, that had experience in the same medical field as I was going to be making my endeavor. So I was matched with Dr. Pedro Ibarra, which is one of the board of members of the WFSA. So how did I make contact with my mentor? The WFSA provided me and my mentor both our emails so we can contact each other. It is responsibility of the mentee, it was my responsibility, to reach out to the assigned mentor and arrange an initial meeting or a follow-up meeting. I had to say that I was really persistent in chasing after Dr. Ibarra, and I'm really sorry. I sent like 5 emails. And afterwards, contact was really easy as we scheduled our monthly Zoom meetings through WhatsApp. The mentorship program is online only, so it was easy to schedule my meetings around both my mentor and my day-to-day activities. How to complete the agreement. In your first meeting, you have to define clear goals. What do you want to achieve with the help of your mentor? So we have to fill out the mentoring agreement during my first meeting. He kindly asked me what were my expectations of the program and what were the areas I was interested in. And I said leadership. As we understood before, my mentor is not a coach. He will not do my work for me. So he will only be a guidance for me in the problems that I want to solve. So our meetings were scheduled once a month, and I understood also the nature of our meetings were confidential because we had to write a confidentiality agreement. Next slide, please. My mentorship. My mentor, as I said, was Dr. Pedro Ibarra. We communicated by Zoom meetings once a month, and the topics we discussed were sharing of experience, guidance, support, tips and tricks about the leadership, feedbacks, and follow-ups. You have to come prepared to the meetings. You have to have an agenda, questions, and the work that you've been asked to do. And also, it is our goal as mentee to take the initiative. Don't wait to hold on. Don't wait for your mentor to tell you what to do. You have to engage and seek opportunities to be able to get the more rewards from the program. Also, research about your mentor, understand their background and their experience to make the most of the relationship. So how has the program helped me? Both my mentor and the program went above and beyond my expectations. Here is a picture of me and my committee of the Asociación de Médicos Anestesiólogos del Salvador. As you can see, we're all young people with no experience, and my mentor helped me to guide everyone into the projects and development that we had. So his prior experience in networking, project development, knowledge of legal support, and handling of various difficulties of medical professionals was key for overcoming Amaya's first year of a completely new board of direction. So it was really nice to have somebody who could guide me through some various projects that we had. What were the issues and how did we manage? One of the issues that we had was time. With limited time in our hands, scheduling the meetings with advance was key. You have to have an agenda and you have to have effort and flexibility. But the key or most important thing you have to overcome any issues as a mentee is compromise. You have to respect your mentor's time and effort. So you have to compromise and make an effort to reunite with them. To be a good mentee, we have to be proactive, curious, and engaged in the relationships. As I said before, you have to have clear goals, be prepared for meetings, and respect your mentor's times and feedbacks. As a special thank you, I want to thank Dr. Perry Badra, my mentor, because without him, my year would be really hard, and he was such a good guidance. That I want to thank also Dr. Carolina Halek, which she gave me the idea to get into the program, and it was the best thing I did. And I want to thank also the World Federation, because this program really helped me. And as a mentee, I know that it did not only help me, but my coworkers too. So thank you very much.
That's really fantastic to hear. And you obviously put a lot of effort into being a mentee. And I think that's really, really should resound with other mentees, that you are, this program is for the mentees, not really for the mentors. You are the driving force, and it's all about, facilitating your needs and what you want to achieve, but it has to be driven by you. So we're now going to move on to Dr. Metia, who also is a mentee within the WFSA mentorship program. She's an anesthesiologist based in Indonesia, and she is dedicated to delivering safe and effective anesthesia care. And I believe she's having a very successful mentoring relationship too. So if you'd like to.
Okay. Thank you, Juliet, and thank you for WFSA for this precious moment. Greeting from Indonesia. Actually, is in the midnight in Indonesia. I'm sorry, and I'm not really fluent in English, but I hope you can understand what I mean. Okay, I want to share my experience as a mentee in this program. I'm sorry. If you see this three picture I put in my slide, in the top of left side, it is my hospitals. We are in a rural area in Barito Timur. Tamyang Layang is a remote area in Indonesia, especially in Borneo. If you want to hear, do you hear Borneo? And then I just one dream for this hospital, because I'm the first anesthesiologist in this hospital. I want to improve my hospital like the good hospital in the world, and I know these programs can make me realize my dreams. And then in April 2024, I see this program, I joined this, and thank you for WFSA because accept me as a mentee, like my dreams can be realized. And then my vision to this hospital, like universal access to safe anesthesia, can be realized in this program. And then the first what I wanted to be mentor, when I know that I'm join this program and I know who is my mentor, that is Dr. Aiman. She's from Royal College of Anesthesiologists. I tell them about my dreams, and then especially in patient safety and resource, human equipment, and then to be a great anesthesiologist and how to be leader from my college, and then from my anesthesian, technician, and nurse in my hospitals. And then how I made contact and agreement with my mentor. Yes, basically we always from the WhatsApp application, but in the first time I'm send an email to my mentor. I introduce myself, and then I give him what I want to be a mentor from this program. And after that we communicate. And thank you for Dr. Aiman because he's a great mentor. We communicate really easy, and then for 3 and 5 times per month, and it makes these programs better to do in our experience. And then what the topics and quality control that I do with Dr. Aimans in anesthesia service, in policy, in patient cases, in my career, in clinical guidelines, and the latest science, because I want to reduce the highest gap from lower middle income countries. We are in lower middle income countries, and I hope my anesthesia service is like in the UK as a developed countries. And first the meet we asked about the equipment and the medicines, and I record that. Even every Dr. Aiman tell with me, I always record that, and I always report to Dr. Aiman, the government, the management, and the WFSA. Okay, how I found the program has helped for me. I always make a target, like for this month I want to be to go to present my abstract to Harvard in pediatric principle. I asked to Dr. Aiman, I wanted to do that. I wanted to make some guidelines to my hospital and present that, and I record that. I say to my mentor and my make a logbook, monitoring evaluation set. Even is to not successful, I do that too. I write it in our monitor and evaluation, and this makes me easy to gain for this program, because my government, my hospitals, and Indonesian Society of Anesthesiologists, they thinks it help for gain these hospitals. After the documentation, I want to share what is happened with us in RSUD Tamiang Layang after we accept this program. This is my President Joko Widodo, and Indonesian Minister of Health, Dr. Budi Gunawan Sadikin. They came in RSUD Tamiang Layang hospitals in July 2024, and then we gain some cooperation with a foundation in Indonesia to acceleration about medicines, about equipment in my hospitals, and then we can get drugs that never been do in RSUD Tamiang Layang. We never usually use Sugammadex for reversal, but after this program, I try to use that. And then in my career journey, I become a mentor for internship doctor in the Ministry of Health. And then the biggest change of the program is before I come as anesthesia, the anesthesia service done by nurse anesthesia, and it's not legal in Indonesia. After I joined this program, we make a big policy in our hospital that the anesthesia service has never been done by nurse anesthesia, only the anesthesiologist for patient safety. And then if you see in the middle of the picture, I collaborate to treat patient with Dr. Aiman. It's like my patient treated by Dr. Aiman from UK and with me to collaboration and a good result to this patient. And then for my career, I got accepted as Indonesian government employee. Thanks God for that. And this is my our step publication and cooperation. In RSUD Tamiang Layang, we had a lot about early adolescent with pregnancy during cesarean section. We and Dr. Aiman start to make initial clinical guidelines for 10 years old, 11, 12 years old that do cesarean section in my hospital. I think that is the big difference for us. So what is my dream to make a patient safety like you in the best hospital in the world. I hope it can practice in Indonesia, especially in RSUD Tamiang Layang. Any issue that I got is time difference, because I'm in Indonesia and Dr. Aiman in UK. So if I send him a message in the morning, maybe Dr. Ayman still sleep. But it's okay. He reply me as soon as possible. She write my message and work culture, because I know Indonesia and UK is different culture, work culture, but in this program we can collaborate that. And thank you for this opportunity that I can share for you.
Thank you very much for presenting, Metia. It sounds like you've been doing so much, and I'm really pleased that the mentorship program and your mentor particularly, he's been, you've had a really good relationship and you've managed to achieve so much in that time, and it's brilliant to see. It's brilliant to see that such a good relationship, and he's helping with clinical patients and policies, and there's such a wealth of experience out there, and it's great that it's being shared internationally, globally.
Yeah.
And I'm very, very impressed how dedicated you are as a mentee.
Thank you very much. Honestly, I wanna give thank you for all of you that realize my dream, and I know that is the precious moment, a privileged moment, a privilege for me to be a mentee in this program. And I hope all of mentee or mentor can get the dreams like me. Thank you very much. God bless you.
So we're now going to move on to this part of the webinar, where we don't have as much time as we hoped, but we've got a good 10 minutes or so to answer questions from mentors, mentees. So please feel free to put your hand up to ask questions, or you can submit them via the chat. I've got some already that I've received when people signed into the webinar. I'll start with one of those questions, and then feel free to jump in if you've got more questions. So one of the questions that came is, and I think you alluded to it, Daniela, about the initial contact with your mentor, and what the best thing to do is when you're trying to communicate with your mentor, but you're not getting any feedback. Daniela, how did you talk a little bit about how you approached it? Can you talk a bit more about what you felt worked, or was it what made that sudden fifth communication work that it hadn't worked on the first or second?
Well, as I mentioned, I wrote emails, but my mentor is really, he has a tight schedule. So I just want to tell other mentees that don't give up, send emails, try to communicate with your mentor. He will come back to you, because he wrote back and he said, well, it's better for us to communicate via WhatsApp. So how did I overcome that mishap? We went by WhatsApp. It is easier, and we can communicate at any time during the day. And I really want to say that Dr. Pedro, he answered whenever he had time, and even in the mornings or even at night, we could communicate. Yeah, so I should say that if you have those issues, do it by email and then go with WhatsApp or Snapchat. Yes.
Anybody in the panel, other panel, have any responses? I mean, all the people that have signed up to be mentors with the WFSA program were all very keen. I've had some recent feedback. Some still haven't heard from their mentees, so they're still waiting for you to communicate if you haven't yet reached out to your mentor. But by default, the people that apply to be mentors are all keen to be mentors. So please do get in contact. But yes, sometimes emails get through, especially hospital emails go into the spam folders. So you can always reach out to the WFSA to re-communicate with them, because obviously other emails that come through WFSA will get through their junk or their spam. And yes, like you say, moving on quickly from an email to WhatsApp, people have time to send WhatsApps in theatres that maybe they don't have time to send extended long emails. And if they're happy to give you a WhatsApp, it's a good approach. Pedro, if you want to ask, you have to unmute.
Yeah. You're mute, Pedro. You're mute. Perfect.
I think it's on now. Okay, perfect.
Yes.
First of all, I think it's important. Hi, Daniela. It's very important, like Daniela mentioned, to try several times to get in touch with the persons, because actually, like Juliet mentioned, the mentors are willing to participate in this process. So it's just a matter of misunderstanding or miscommunication or whatever that might lead to some initial complications with the communications. But anyway, aside from that, I'd like to say that when this project was proposed by you, Juliet, I definitely believe that it was probably one of the programs that the WFSA would start that would have the largest impact. In my perception, this program is the most likely to produce impact in an anesthesia practice. So it is a program which once you suggested it, I was very, very, very happy and optimistic and enthusiastic to support, because I believe that these kind of relationships are what are able to produce great impact in our communities. I was privileged, I must say, to have Daniela as my mentee. I'd say that it's very difficult to get a mentee like Daniela, who is so willful, okay, so strong-willed, and so dynamic. And so it has been, I mean, we've been in contact for almost 9 months already, but it has been a very, very productive relationship. You mentioned that it is for the mentees, but actually for myself, it has been also very productive. And I have enjoyed it very much. And I think that the possibilities of linking people who are able to maximize the efforts of people who are beginning their careers is one of the best ideas that we have available. And I'm sure that it is, I must say, I mean, not because I'm a mentor or what, but I'd say that conceptually it is one of the best programs that the WFSA currently has. Okay, so thank you, Juliet, for all the efforts that you put into starting this, and I hope that it will continue to thrive and succeed as it is as of now.
Thank you. So a question came in from a mentor is, what resources and where can I learn skills about being a mentor? And Dr. Sheraton, you alluded to the book. I've also got the book. Let me see if I can get that in focus. It is Coaching and Mentoring at Work. I don't know why that's blurred. Oh, there we go. So there is a lot on the internet about how to be a mentor, but this book is particularly very, very good. Dr. Sheraton, any other resources? I think the e-learning for health UK does some teaching about how to be a mentor. Anywhere else you would suggest, or Dr. Redfern?
Yeah, I think that there's a lot of stuff out there, but fundamentally you have to practice, and you have to practice on real life scenarios. So that's why I think that idea that I was trying to bring in of co-mentoring each other, so that you have people that you go to them with your challenges, and maybe they come to you with theirs, and also a bit of peer support. But you have to practice, because unless you practice and reflect on what you're doing, it's really difficult to improve in the skills, and also if you don't have any peers who are reflecting back to you, it's also quite difficult. Nancy has way more experience, so I'm going to hand over to Nancy to add her bits on what she thinks about that.
Yes, I think there are some, as you say, some videos and other things, but I almost think that joining a scheme and perhaps getting a bit of support, you learn as much as mentee as you do as mentor, but deciding on a framework or model that you're going to follow. And the one we chose that you see in that coaching and mentoring at work, understanding what on earth the current situation is, working out what somebody would really like, and then how they go about getting it, is a very simple way of doing things. And reading and practicing with real people, I think, are coming on a course if you possibly can, but those are the two things of working in a group like this and learning and reading and experiencing it together.
Very good. Sorry, I've got the list of questions. Another question is from a mentee, and they don't know where to start with what they want mentoring about. They think they want a mentor, but they don't know where to start. What topic do they pick? How do they start? I think Daniela, Metia, you both had very distinct ideas of what you wanted your mentor to help with you, but what if you're somebody who wants help but you don't know?
Yeah. For me, that's exactly the thing, is to try and understand what the current situation is. So if somebody said, I think I want a mentor, but I don't know what for, I would start and say, well, just tell me a bit more about that. And over the course of exploring, well, what's life like? What are the good bits? What are the less good bits? What do others think? What strengths do you have? What's worked for you in the past? What opportunities are there out there? People will come down to, right, well, actually, I do want to change something, and I think I'll do this bit. So sometimes I'll start mentoring somebody who wants to take on I was talking to somebody today who was going to try and take on a clinical director role. And by the end of the first bit of conversation, he'd worked out that actually what he needed to do was to get his work-life balance a bit better, because then he could do that job better. So you come in, and I think it's a bit wrong to say you must come in with a goal, because you don't really understand what's going on. And the goal that is relevant to where you are might not be the goal you walk in with, but that's fine. Daniela.
Great, yeah. Daniela?
I would just advise a mentee to listen. Just listen to your mentor and listen about experience. Sometimes, as it was previously said, you come to the program thinking that you're going to learn about leadership, and then suddenly I started learning about project development and about judicial things and support, because that's Dr. Pedro's experience. So I would say for the mentee to just listen to your mentor, just absorb whatever experience they have, because they can guide you even in your everyday work. So even if you come in with an idea that you only want to learn about leadership, maybe the program will help you with other things like tactics, skills, or people skills. I don't know. But it depends on your mentor's experience. So I had the privilege to have Dr. Pedro, and he helped me a lot, and my coworkers, because I want to say that the program is also something that's paying forward, because as a mentee during the year, I became a mentor for my students and for my coworkers through Dr. Pedro's experience. So I could tell somebody else, así como, oh, I learned something new and I have this new knowledge. And they knew about the program because I was in the program. So they had, I don't know, my students had another view of what I was doing because my mentor was giving me other developments. So yeah, I just wanted to say that for the mentees, to listen to your mentor and to get into the program with an open mind into what you want to learn, and you learn a lot.
Brilliant. Thank you. There's a couple of questions that have just come through. What happens as the mentorship program closes? What happens next? Can a mentee carry on for another year? Yes, you can carry on as a mentee for another year. You can ask for a new mentor, or if your current mentor is happy for you to carry on for another year, we are more than happy for you to carry on with your mentor for another year. How many currently have we got mentor and mentees that are working together? I think we've got about 40 from the data I've been collecting. So we advertised, you know, and we got quite a lot of people that applied to be mentees, a lot of people that applied to be mentors. There were a few people that couldn't be because you've got to be part of an association, so they didn't meet the criteria. And then, yes, of that, there's about 40 that are currently matched. I think there are quite a few mentees that still need to get there and communicate with their mentors. There are some matches that are not actively communicating yet. And that's, again, why we're running this webinar, just to say to mentees, you know, just make contact. Even if you don't know what you want to be mentored about yet, just chat with your mentor. I know there was a mentee mentor at the very beginning relationship that was like, whoa, he doesn't know what he wants mentoring on, and I don't know what about if the mentor can help me, but I know that they're having a very good relationship now and they're achieving lots. I think one of the questions I also have been asked, and I know we're coming to a close quite soon, is how do I know if my mentorship relationship has been a success? So Nancy, how do you define success with your mentorship relationships that you've had in the past? And then I think we might need to close because we've come up to the hour's time.
So for me, I would, if the relationship is based on mutual respect, empathy, and I've forgotten the other one is now, Nancy. Genuineness. Then that it should feel safe enough that if there's a problem, that the mentee will say that there's a problem, or if the mentor's having a problem, they will say, oh, I'm not able to concentrate very well today. I'm sorry if I haven't given you quite what you wanted. And at the end of a session, I write notes for myself that what went well, what didn't go so well, what would I like to focus on next time. And then if I've got something that I'm particularly worried about, I would speak with a peer, so Nancy or Rob or any of the other mentors in the mentor network that we've got. So I think the feedback that you get is one way, and there are more detailed things. You can use the things similar to the Kirkpatrick model where you're looking at you know, basically feedback, the change in skills or knowledge of the mentee, the change in behaviour of the mentee. They might feel more confident, might progress more, and then the last thing might be what actions you would have expected the mentee to have achieved. So those are the different levels. You can use a model like that if you want to look at outcomes. Nancy and I are hoping to develop an app that would include some of that feedback within it, that would be anonymized, so that you could collect the back end data, and that would be something that would help to find out. So you want to know how much activity is going on, but you want to have some qualitative and more detailed information as well. But you need to be constantly, there's no perfect, is there? There's no perfect, I'd say, in mentoring. And so you've got to keep reflecting on it and thinking about how might I do this better? Or what did I do well? What did I do so well? I'm sure Nancy's got far more.
Yeah. No, I mean, I think that's absolutely right. I think the result is really what the mentee feels was going on. And as Tay says, you know, thinking about, did I give my best self there? And sometimes we do, and sometimes you know, life gets in the way a bit. But we've just heard from two wonderfully enthusiastic mentees who have broadened their horizons and yet, you know, driven forward the things they really wanted to do. But it's that breadth of understanding and networking and being in a group of people who really want to help everybody achieve their full potential. And I think it's that just sort of bubbly enthusiasm that is one of the things that I think when we're talking about this, it's a real success, but it's something that's quite hard to sort of get other people to publicize and to recognize that, as Pedro was saying, this is one of the most effective, most efficient, most rewarding ways in which we can all help each other. But somehow it still goes under the radar.
I agree, exactly. I think, and then to listening tonight has really made me really pleased that, you know, this program is helping people, you know, and I think it will grow, hopefully will grow from strength to strength. But sadly, we've just gone over an hour, and I know people have lives, and so I think we're going to finish with another quick poll to find out if people felt more confident after our webinar, because that's good feedback for everybody who presented, and I definitely would feel more confident both as a mentee and a mentor with having listened to all those wonderful talks. So yeah, and the poll is agreeing with me that everyone now is in the 8, 9, 10 feeling extremely confident about being mentors and mentees. So that's really wonderful that you found this webinar so useful. And for those that weren't actively online, please share it with your colleagues. Sorry, those are online, please share it with your colleagues who weren't actively online, because I know it's difficult sometimes with time and the evenings. I'd like to say thank you. I'll hand over to Dr. Lewis now to do the final close, but thank you everyone for talking, and thank you everyone for signing in and listening to us.
Thank you, Juliet. I would like to thank you, Juliet, to chair this session, and I would like to thank you to all of our speakers to share your experience, which at least for me, was very, very important. I learned a lot, and thank you for the presence of all the mentors and mentees in these programs. I totally agree with Pedro Ibarras. I think this is a very, very important WFSA programs, and we are running only the first version of the program, and we hope in the second semester it started again, and now with much bigger. And just to give some numbers for you about this first version of the program, we had more than 300 applications for our mentors and mentees in this first version. 170 was for a mentee, a little lower for the mentors, and this was from 50 different countries. But it was possible to meet, as Juliet mentioned, a little more than 40 pairs, and because of the interests of the mentors and the mentees. And this is spread around the globe. We have 34% from Asia, 33% from Africa, almost 20% from Americas, 8% from Europe, and 7% from Middle East and Oceania. So we hope now in the second semester we can have more mentors and more mentees in this program, because we totally believe that this is a very, very, very important program inside the WFSA. So again, thank you very much for all of you. Thank you for your time. Thank you to your time to share with her your experience. And this webinar will be in YouTube in 48 hours. Okay. Thank you, Juliet. So have a great week, everyone.